this edition of the Urban Debate. We now move on to the second big conversation point tonight here. Viewers, let's talk about what is happening in West Bengal. And it is the unfortunate destiny of the people of Bengal, who were not only ignored for the last several months when politicians were busy campaigning, making future promises and exchanging barbs as the second wave hit the state, and then they were caught unprepared. But even now, it seems that there is barely any focus being given to this pandemic. I want to just put this in perspective for you. What it is that the people of Bengal are facing and what it is that the netas seem to be doing, including Centre, BJP, state government, sitting chief minister and her party. So on one hand, 19,000 cases were registered in one single day. 147 people officially were registered as dead in one single day, the highest that the Bengal has seen in recent weeks. On the other hand, the netas were being arrested. Ministers and sitting MLAs were being arrested by the CBI in the 2014 Narada scam. On one side, the cases rose 970% since the 1st of April to the 17th of April. On the other side, the chief minister was not at the control room or the war room for COVID, but at the CBI office, protesting these arrests of her ministers. On one side, the vaccination in Bengal has dropped 63% since April 1st. And by the way, already the numbers for Bengal were not very great. Since then, it's further come down. On the other side, there was just charge and counter-charge barbs being exchanged by all political parties linked to the West Bengal. On one side, people are running around for hospital admissions. Hospitals are overburdened, stretched completely. There is a problem for oxygen beds. On the other side, the commentary focuses on TMC netas, and that's the BJP's focus as well. On one side, right after the counting of the results, a lockdown was announced in the state because obviously a mess was made during campaign season, and so the people had to pay the price by being locked up. On the other side, the netas will still not learn their lesson, and so a large crowd was gathered outside the CBI office, led by the chief minister, who was inside talking to the CBI or protesting God knows what for 6 straight hours. It just forces me to think about who is leading us in this war against COVID. And does anybody really care how many of us fall ill, get hospitalized, gasp for breath, lose our loved ones, or die ourselves? Just forces you to think about that. Let's say good evening to the panelists who are joining me on this conversation. Dr. Kunal Sarkar, cardiac surgeon, Medica Super Specialty Hospital of Kolkata, a very renowned name there. Shivam Chavda of the BJP, Manav Jaiswal of the Trinamool Party, and Avajit Ghoshal, news editor for Money 9, joining us right now. Dr. Kunal Sarkar, I want to start off with you, because I feel it is still important not just to highlight this to our netas who may want to be oblivious, but also to the rest of the country of just what is Bengal's COVID challenge as we speak today.
Thank you for the opportunity. And the first thing we have to highlight to you is that unlike the west of the country or unlike the north of the country, Bengal is yet to peak. And the second challenge with Bengal right in our hands is that Bengal has been a traditionally low tester. And because we test significantly low as compared to some of the major states and cities, it is very hard to gauge for ourselves where we are. So I wouldn't really flatter ourselves with that 19,000 odd numbers, because I think, like the rest of the country, as many people have said, that we are seriously undercounting our prevalence and we are seriously underreporting our mortality. Like the rest of the country, we are no exception. But this is for sure that Bengal is yet to peak in terms of pandemic terms. There is tremendous pressure on healthcare. We are running an absurdly high test positivity rate of around 30%, which is basically absurd, which says that there is a lot of disease and there is tremendous undertesting. And of course, this time what is very different from the last installment is that thanks to the monstrous election process of 8 weeks, we have managed to spread this problem uniformly across all the districts of Bengal. And it is not just Kolkata. Today the focus is Kolkata, the 24 Parganas, the mid Bengal, North Bengal, everywhere. And I hate to think that unlike say a Maharashtra or some other states which has a lot of cities, which has a lot of metropolitan healthcare infrastructure, Bengal is seriously deficient on that front. And what you have mentioned today is, today, the whole day, the political pyrotechnics, the political acrobatics, politics and CBI put together, it was the worst possible timing we could have chosen for that kind of acrobatics, because it made a total political mayhem. It was predictable whenever you do something like that. Why in Bengal? In any state for whatsoever, you are going to have utter pandemonium all around. And absolutely this was the worst possible timing. But for a mere doctor, I think public health takes a primary priority over presumed political justice. This is something what across the board we need to understand. But have we understood this remains the question.
Have we understood this is the big question, or do we even want to understand this? This is something that I want to hear from the politicians. So Manav, I'm going to ask you this question. Your excuse up until 2nd of May was, what can we do? We don't want to carry out large rallies or campaign in such a manner that it becomes detrimental to our state. But the Election Commission put these dates. Now what is your excuse for the kind of dharnabazi which is going on today, rather than focusing and being in the war rooms and building the state's infrastructure?
Well, in the first place, namaskar to everyone, all the panelists today and to the India. Well, it's quite a shocking to see how the CBI has been interacting today. And you know how it is in India, in Bengal, the way BJP had lost Bengal, and the way the BJP has actually hurt the heartland of India with so much of deaths, the dead bodies lying in the river Ganga. They want to just hide all these, narratives. And what they want to do is they want to focus the country towards Bengal. This is what the narrative of BJP is. They have lost it and they cannot take it the other way around. While as far as what we are concerned about COVID is, we are actually working really hard. Our Netri, Shri Mamata Banerjee, is working really hard. Day and night, our administration is working really hard. We are adding a lot of hospital makeshift rooms, hospital beds. On top of it, we have also floated a tender. We are about to float a tender for the vaccine. Problem is, the country, which has actually had a very beautiful federal structure before 2014, today it's dwindling. Today we have a prime minister, or probably the central government, which later on, initially they had everything under their own grip. They did not want to tell anyone, discuss on the micro level, putting up a lockdown, going with the vaccines, any policies, they never discussed with the bottoms down. Now what has happened now, the crisis is because people are dying and we are in need of vaccines. They have let you go. You go and you buy it across the globe. Whoever is supplying it to you, either we'll be fighting with Punjab will be bidding and fighting with Tamil Nadu and bidding and fighting with Maharashtra. Whoever has more money will be able to get the vaccine. This is how the government of India has completely done a beautiful narrative of federal structure. While we also want to know what really happens with Adar Poonawalla. Is he really scared of the country like India? He has to come back, isn't it?
Manav, I'm a little lost right now. Sorry, I'm a little lost right now. I don't know what you're alluding to and where you're going with this. My question to you, Manav, is very straight and simple. When cases have hit 20,000 each day, 150 people dead each day, do you think it is necessary? You have just won the election. You have now the power in the state for the next 5 years. Do you think it is important to break COVID norms, to do dharna outside CBI office, for the chief minister to spend time in the CBI office politicking rather than looking at fighting how to fight the pandemic? That is my question to you.
Now, can you tell me something? What is the nation rate? What is the national rate? Is it going up from the before 2nd of May, or it has come down? It is the other way around, isn't it? It's coming down all over India. It is only because that you people did not talk to the election commission. You did not question the election commission. You did not question the 8 phases of election which happened in Bengal. Today we have landed in this kind of a situation. And today what the CBI is doing, it is actually being a puppet in the hands of the BJP, the central government. And they are trying to intimidate Bengal in any means they want to do it. And if you are not doing dharna, it was an emotional outburst from the people of Bengal, from the people who have voted for a government, for the persisting government. We had a lot of things we have done in the last 3 months. We have suffered a lot.
People
And we are still
want
suffering.
remdesivir drug, people want oxygen and oxygen cylinders, and people want ventilators, people want vaccine shots, people
Great.
want hospital beds right now, people
Lovely.
want the support of the government in terms of testing options, testing at home, nursing available, medical staff available, and all the medicines available, oxygen to be given to them when required. People are not going on any kind of emotional outburst because the
So you really
CBI
want
has
to- you
woken
really
up
want to say
again.
people
Now
who have
you
come
want
in
to
the
put
morning,
the blame on the
they have-
media
who
for
are
not
they?
questioning the election commission. By
We
all
did not
means,
question-
please
we
go
didn't
ahead
question
and
the
do.
election commission. Did you
But
ever
do
question the
remember
election
that
commission?
people will also
Is the
remember
media
how
doing
you
their job
forgot them.
responsibly?
And
No, we are not doing
one
policy.
minute,
We are
I
doing
want to
favor.
take this point across to Shivam Chabra as well. No. You put the blame on the media. Let it be now. I got the answer from you. You don't want to take responsibility for governance even now.
No.
Okay.
We are
Shivam
much
Chabra,
more
this question to you as
responsible
well.
than the rest
Is
of
this
the
the right
BJP
time?
government.
Why are
We
we
don't
now?
have a double engine
Should we
government.
not?
We are
1 minute,
doing our
Manav.
job
1
double
minute,
engine.
please. Let me move on. Let me
No, you
bring in
cannot
our other
just-
panelists.
you cannot just
And
say
I
something
have
like
a
that.
question
Tanvi,
from
this is
Shivam
not fair.
Chabra, please.
This is
I
not
want to
fair.
ask Shivam Chabra, is it not true that the CBI is being selective in taking action where everybody who was named and accused and under the scanner but shifted to the BJP has been forgotten, and the only key villains in this whole Narada sting seem to be of the TMC? And I am not saying that. The media organization and the people who actually carried this sting operation, the Narada sting operation, are the ones questioning this, Mr. Shivam Chabra.
Yeah, I think being the selective or objective is to be answered by the CBI, not by the BJP. I'm a BJP spokesperson. I don't want to answer what the BJP CBI is doing. And if I only stand by the statement of the CBI, if some investigation is being carried out, he's been summoned by the CBI court. Why is it being politicized? And why is everything being politicized? I mean, I was just hearing to what Manavji was saying. Unfortunately, he was raising questions at the Election Commission of India, who carried out an election in West Bengal. You could probably debate about the, let us say, merits and demerits of the same. But unfortunately, I wish to remind him that his party's leaders were part of the same group of leaders who had this, a consensus that yes, the election should be carried out. I mean, his party was a member of that collegium, which was called in by the election commission just before this entire pandemic was, spreading. So I don't think they should probably fall out from the claim. And as far as the politics part of this concerned, unfortunate that the chief minister of the state has stood by her MLAs, the ministers in charge, and went all across to the CBI court and probably defended the way it is being done. It is unfortunate. I mean, she carried out a crowd of about, say, hundreds and hundreds of people out there, protested, which was again unfortunate. I was just hearing to what Dr. Sarkar was saying, and I think I am a responsible person of the government, and I sincerely feel that such crowds should be
Okay,
crowds
so
should not happen. should not happen. It's an alarming situation, and I think
Yeah, I mean,
you could probably put me into that.
let's
Put me into
not
that
make
set
arguments
again.
about crowd,
But,
Mr. Shivam
but
Chabra,
yes.
because up until 16 days ago, even your party didn't believe that crowd was a problem in West Bengal when you were actively campaigning and boasting about large crowds in your rallies. So let's not take a higher moral ground as far as crowds are concerned, at least not from a political party. I'm not going to take this argument. Because you say that the question I asked you is for CBI, not for you on selective action, let me rephrase that for you. Let me ask you this. What is it that you spotted when it came to Mukul Roy or Suvendu Adhikari or Shovan Chatterjee, people who were stung in the Narada scam, which is visible what happened there for everybody to watch, but are still not under the scanner today? All of their action has been forgotten by the CBI. What did you? How did you figure out which were the cleaner guys between this entire Narada gang? How did you figure out that these guys were the cleaner ones in the entire Narada gang?
I'm sorry, but I'm not being trying to be very righteous on this part. I'm just trying to say it is for the CBI to decide. It is for the CBI to decide who's there, who's to be investigated, who's not to be investigated. I'm sorry, but I'm not a spokesperson of the CBI, so I don't want to answer on that. But I only can say if the investigation was was taking place at the Kolkata, what made Trinamool Congress chief and the chief minister of West Bengal go right up to the CBI courts and protest? I mean, amidst so much of crowd, what made her so, why was she so scared of it? That is the biggest of the big question. Nobody's trying to, question that, which is unfortunate. So it is absolutely okay. I mean, as far as the CBI is concerned, let you please ask the CBI spokesperson to probably put out a declaration or probably explanation on what all is happening. But as far as I am concerned, yes, you agreed to the fact that these four people were
but I
involved.
am not asking you to
fact,
explain CBI's action. I am
but
asking you to explain your action in terms of bringing on people on board who are also under the scanner in the Narada scam.
Again, I'm saying
Can I answer you this?
it is for the CBI side if they are actually convicts or probably accused in that case. It is not me. So I have to answer from my party's point of view. So as far as my party's point of view is concerned,
yes,
I'm
and
just
your
saying
party brought these people on from TMC. I am asking you about that. Allow me, Shivam Chabra, I will try this one more time. Mr. Chabra, listen to my question, please. I am asking you, then why did your party bring on people who were also accused in the Narada scam, for whom arrest warrants were also issued, people who were also questioned in this scam? How did you decide to take these people onto your party?
We don't decide. It's for the courts to decide. Let the court take an order on this. Being accused is not being a convict. You believe in this, you believe in a democratic setup. You believe in a democratic setup of this country.
Lovely.
If you do believe, it is for the courts to decide if somebody is accused or if he's convicted. If they are accused, accusation could be made against anybody. Accusations were made against the Prime Minister of this country by Or do you think he was convicted? He was not. So it's absolutely up to the courts to decide.
Yeah, correct. Okay. Yes, before I go across to Avijit, yes, Manav, you wanted to come in.
Now I need to tell you one more thing. Well, it's a beautiful mandate that we had received just to go for the people. The people have actually believed in Mamata Banerjee on the 2nd of May itself. We have got the result. Now what has happened, what is the problem with the BJP is, a lot of people from the BJP camp, they want to shift back to TMC. They have started believing in the real ideology of Mamata Banerjee and they want to come back. Now BJP, by this act of the CBI, the scare mongering, what the BJP does, if they,
who wants to come back to the BJP or TMC? That is again another question. Let us not debate on that.
Let me do it.
Let us not debate on that.
Let me answer you. Don't worry. We are a very religious, regimental party, and we will be taking care of the state. And God permits, we will also do it for the country. Don't worry. My answer was what BJP is doing with the CBI is a scaremongering.
Okay. 1 minute, please. 1 minute. Can I hear one person at a time? Can I hear one person at a time?
This is the desperation that
yes, Manav, finish your point.
He's desperate. Now let him answer. Are you ready?
I'm not desperate at all. I'm not desperate at all. I think you are
I waited patiently.
What
Sir,
will
I
they?
waited patiently, sir.
चोर की तारीख में तिनका तभी तो ममता बनर्जी actually went up to the CBI
Sir,
court and
sir, there's
defended the
another
four
one.
legislators.
There's another one. Khisiani Billi Khamba Noche. Well, that is too tadak. I don't want to do it on the channel. This is a respected channel. Well, I need to tell you, Tanvi,
Well,
what the
let
problem
me
with the
let me
BJP
let
is.
me just move
They have
on.
sensed,
Okay.
they have
Both of you
sensed
calm
that
down. Both of you
a lot
calm down.
BJP
Take a
turn
deep
those who
breath.
have gone to
It's
BJP, they want to
interesting
come
to
back to
know
TMC.
neither of you still want to talk about or still want to focus on the COVID challenge that Bengal is facing. Now, we've got one of the biggest names from the medical fraternity of Bengal here on the panel who's listing out what the challenges are and what the ground reality is. Let me add to that. Day after day, I'm reading more and more heart-wrenching stories, like in many other parts of the country, even from Bengal, even from places like Kolkata, the capital, where people are not finding beds. For example, this is reported in the print, Amitabh Pal, son of a 55-year-old patient in North Kolkata, said that the mother was running a fever for 5 days when the oxygen suddenly dipped to 80. They struggled to arrange a bed every single day. They tried and they failed. By the time they managed to get an oxygen cylinder at home, they didn't know how to put it. They couldn't put it correctly. By the time they managed to get a hospital bed, the next day his mother passed away. There are more horrifying stories, Avijit, which I'm sure you are well versed with than we are sitting here, outside of West Bengal, of the struggles people have in terms of even getting basic care, a single bed. And it's also politically divided. Basis whichever area you are, that political party is the opposition party there is going to refuse helping you at all, saying if you are from the TMC area, go and ask a TMC person to help you. If you're from the BJP area, go and ask a BJP person to help you. Is that what it has come down to, even for healthcare during a pandemic?
You want me to respond to that? Hello, do you want me to respond to that?
Abhijit, Mr. Gosal, go ahead, please.
I don't think it has reached that point, but just let me to give you one small example. You gave an example, let me give you one. On Sunday, that is yesterday, there is this MLA of BJP, Partha Sarathi Chatterjee, who won this time from Ranaghat Northwest constituency. He was earlier with the TMC. He switched over to the BJP before the elections. He won the polls. Now comes the fun. Now this man was down with fever for 3 days. Now somebody close to him, he didn't get in touch with, he didn't get help from his party, his current party. He didn't get help from his previous party. Now he called somebody. He called somebody who happens to be quote unquote a red volunteer. Now I am not holding any brief for any party. These guys are just young members attached to the left. Now these guys got an oxygen cylinder. These guys got an ambulance, and these guys transported him to a hospital in Calcutta. Now my point is, we have seen politics of the worst possible order today. It was tragic, it was miserable, and it was ridiculous all at the same time. It was absolutely pathetic. Now, where are these examples? It may not have reached the extent, as you said, that you divide the patients on partisan lines. It certainly hasn't reached. But are we really, benchmarking ourselves against that? If I know Bengal is a deeply divided political state, very deeply divided, where even relief is allegedly divided along partisan lines. And why allegedly? It is true. It has happened down the years. But would we see something like that? Relief of COVID, oxygens being distributed along partisan lines, hospital beds being distributed along partisan lines. You will get a shot of a vaccine if you belong to a ruling party, or if you belong to a party which has won the elections in a particular constituency. I mean, where exactly are we heading to? But given what has happened today, I won't be surprised if that happens. Just imagine the ridiculousness of the situation, what we saw today. After 6 years of investigation, almost 6 years, the CBI picks up people before submitting the charge sheet. Now, and at this time, now what were they doing for all these years? And after 5 years, do you really expect that somebody and in an influential position will wait for 5 long years or more to tamper evidence if they have to? I mean, everybody wants to tamper evidence to get scot-free.
Yeah.
So, do you really need somebody to wait for 5 years? And the appeal that the CBI made today in the court and rightfully rejected, they have all been granted bail. I am no votary for TMC, but it was absolutely, I mean, even a child could see what they were playing up to. And what the chief minister did, what the ruling party did, was perhaps even more deplorable. Now, they were holding guard of the fortress to, ward off the virus. I mean, all the 10 crore people who have looked up to you for the third time, they want you to protect themselves and not, march to a CBI office with thousands or hundreds of people and to sit in a dharna. I mean, have you seen any, I mean, can anybody expect distancing protocols in that crowd who are angry and who are shouting and who are trying to bring down an iron gate? So what exactly are we heading?
Yeah, you've made a very valid point. Let me now take this back to Manav Jaiswal. Now, Manav, and I agree with Avijit as far as the action is concerned. I mean, to make these arrests at this point without being able to show what additional evidence you've gathered to arrest these people, obviously there is politics here, and the timing is set. Nobody is doubting that fact without either of us going into the merits of the case. But here is the question to you. What is the point of what was done by your party today? You won the mandate of the people for another time. You formed the government, you have an overwhelming majority and a big task at hand. What was the point that it was served by spending those 6 hours at the CBI office today?
Well, the most important factor is the Netri. She's a frontline leader. And what the CBI is doing and what the Modi Shasan is doing, they are the biggest party in the world. They're the richest and the biggest and the most powerful party in the world. What do you think? They're going to let go of anything just like that? They've been shamed by the kind of, what do you call that? Dirtiest politics or dirtiest narrative they have done in last 3 months in Bengal. They have actually completely focused to conquer Bengal. They want to conquer. They want to rule. They don't want to serve. BJP is a party who wants to conquer and rule, just like the Mughal dynasty or probably somewhere on the other planet. If they think like they want to serve,
Impression could be seen, Manav Jaiswal. The
doesn't
kind
really
of
matter to me
treatment
the
the
kind
governor
of
of the
politics
state
what
was
the BJP
given.
is doing.
I'm sorry.
The narrative
sorry,
that
Manav
they put,
Jaiswal,
their divisive
kind of
politics that they
treatment the
do.
governor was
It is
given
below the dignity of being a human. They want to hide.
One at a time, please. Mr. Chhabra, I'll give you time. Let him finish.
Condemned it. I'm sorry, but not a single leader of the party condemned.
They've forgotten
attacks on the
that the
Shankar.
gentleman who is sitting
Shameless.
with the big beard,
Shameless.
he did not even sanction the oxygen plants. He gave it to one person. They do not know what to do with the vaccines. The vaccine owner runs away from the country. That's a 56 inches chowkidar.
Come on.
Now you have
How
to tell
is
me,
what your
you have
party
to tell
did
me
today,
that
Manav? I understand all of
tell me
this.
that how do we fight?
Okay, 1 minute, 1 minute,
We
1 minute. Okay.
got a mandate. People were there with
Are
us.
you
Still
just
they want to
senses?
do-
1
still
minute,
they want to
1
do
minute,
divisive
please.
politics.
Manav, the problem with you is when you start off, you don't even take a pause to breathe. Calm down, calm down. I understand the point and I will get the PGP to respond on it. But I am still not understand. I still don't understand. I am asking you a question. How is that still connected? How are center's failures today connected to how you handle the CBI situation rather than focusing on the pandemic today?
She
That's
stood
my
by her
question.
people.
Please
She
answer
stood
this
by
and
her
then the
people.
BJP can respond to your other allegations.
Simple, very simple. As a Netri, as a leader, she has stood by her people. She has stood for the state. She has stood for the people who
What
have
about
voted
people of
and
Bengal?
who even have not voted. Who have not voted for her. That's what I'm saying. The people of Bengal. She has stood by them. That is what it is. And people who have come there today, they are the emotional people. They are the emotional voters, emotional people and the citizen of Bengal as well as India. They came in and they were told to go back home. They were told to go. All the major leaders, everybody told them, you just go back home. We are not needed here. Because Didi herself was doing everything herself. She was looking after her children. That is what she did. As a mother, she took it also.
Okay.
She took
Okay.
takes a bullet.
I have a question for
She's not
Dr.
a
Sarkar,
coward
but
who would
before
go
that,
to
let
absconding
Shivam
when the
Chabra
world is
respond to
when
this.
India is dying.
Okay. Let's
When India is suffocating.
let us get a response from the
Shivama,
BJP
hi.
on this. Let us get a response from the BJP on this, and yes.
Again, in the high moral ground, Mr. Jaiswal should answer. The governor of the state was manhandled. Can you beat
Moral
that?
ground. Moral
The law
ground.
and
You say
order of
moral ground.
state, the law and order, the law and order
Wrong.
of the
This is
state
moral
is at
ground. So you're
stake,
saying moral ground.
and not
Okay,
a
no.
single leader.
This is
I
not
cannot
fair.
hear you. I cannot
Can
hear
I
you.
just
This
hear
is
Shivam
BJP.
Chabra,
Beat
please?
that.
Is BJP?
Manav Jaiswal, do not do this. Do not do this. Can I just hear Shivam Chabra? Shivam Chabra, please. Yes.
It's
The second
appalling.
thing I want to
Moral ground.
say, as the pandemic is concerned, I, being the responsible spokesperson of the National Party, want to assure the West Bengal government of all due help what is required from the central government. But unfortunately, again, I would say unfortunately, I don't want to get into kind of politics out here again. But unfortunately, I wish to understand you've been to the power for past 10 years in the state. It is more responsibility of the state government, if you understand the federal structure of this country, where the state government has more of the stakes in the health department, we need to understand and say what kind of miserable situation is going to happen. I could foresee. But unfortunately again, we have to understand, that this is not the time to probably enroll too much of crowds. It is not the time to engage into too much of politics. I wish to request Mr. Jaiswal and his party, his leaders, his Netri, the mother of West Bengal, and what all jargon is trying to use to probably use all her energy and minds into the welfare of the state as of now, because India is fighting COVID, and we are all here to support him any ways he wants to. But let us not get into too much of politics. We've got ample time, another 5 years, to probably counter allegations against each other.
Okay, I want to go back to Dr. Sarkar and ask him this question. Dr. Sarkar, and in the light of what the ground reality is and the big challenges that are faced, I am still trying to wrap my head around why the newly elected government and the party and the chief minister would focus on fighting this political battle right now rather than helping people and saving lives. Now, is there a sense that perhaps because this task is so mammoth, on ground people are angry and disappointed, which is why rather distract them with this kind of political rhetoric and theatrics?
Well, I wouldn't really have such a deep insight into political, reactionary politics. But my submission, Tanvi, is that in the history of the world so far, never has a public health situation been sorted out by the use of political cunning. So political cunning can wait for another day. If you are remotely interested in what's happening in Bengal, I mean, not you, as of the people who are otherwise engaged and politically invested, they need to understand one thing, that we will not perhaps be enjoying what is believed to be the sharp upstroke and the sharp downstroke of the second wave that the rest of the country may see, because we have been injecting the inoculum of infection in our society, in our region, persistently for 8 weeks, and very sadly, even in the midst of the lockdowns, we continue to have these mega lapses. Now, who engineered it? Who triggered it? Was it avoidable? Are all important questions. And I think, people have come to their conclusion and they will speak when the time comes. Now, what are the specific issues? I would just like to state a few in Bengal. Number one is, through Mr. Jaiswal, many of his colleagues are trying to do their best, but for number one, we need to decentralize and deregulate the testing of COVID in Bengal, because today, of all days, we have tested almost 10-12% less than what we did yesterday. And simple stuff like, the rapid antigen test, the cartridge test, etc. There is no sense in the government through the health departments, etc., being very restrictive, being very regulative about those things. In the entire state of 100 crore today, we are still stuck with around 100 or RT-PCR labs, and most of them clustered around Kolkata. You just journey out of the city, we are wanting, because unless you test, not neither it, first of all, you don't treat adequately, and secondly is we don't really get a real-time idea where we are heading for at the moment. The second thing is that, we talk about cooperative federalism, etc. Yes, great things. We haven't seen much of it in recent times, at least not in my part of the world. But even if you see through the 3 or 4 good television channels in the evening, you will get to know that through Mr. Jaiswal, I want to appeal to the government that we need to have a centralized bed management system like people of Mumbai did, what Kerala is doing at the moment, or Bangalore has adopted at the moment. Because politics apart, you see, the kind of misery, you just gave an example, Tanvi, the kind of misery that people are going through when suddenly one person falls sick in the family in the dead of the night to find a hospital bed. And you end up thinking, who is sicker? Is the chap with the COVID sicker, or is the relative trying to, who will become more breathless, the relative or the patient? After the relative has had to make some 100-odd phone calls searching for a bed. So we are not getting that act right. We need to learn a lesson from what the other cities have done and implemented. So decentralized states have a centralized system of bed distribution. And thirdly is, Bengal is one state in the country which has twice the number of government hospital beds as compared to private beds. And we still haven't deployed, we still haven't used even a third of the capacity which is available in big government hospitals, in private medical colleges, and in this need of the hour, it makes no sense. What are we saving ourselves for? Today is the day. This is the time at the height of the pandemic where we need to commit the last doctor, the last bed, the last nurse to address this present situation. So I think, when the government gathers itself around, has less of these very avoidable political distractions, then please let us mobilize our resources. Let's have a centralized allocation system. Maybe you do it in clusters of different districts. The entire state perhaps cannot have one war room. You can have it in clusters. And we definitely need to deregulate and decentralize COVID testing. You are at 30% positivity. It doesn't cost us anything for the clinic down the road. If the clinic down the road can do a cancer test, a clinic down the road cannot do a simple RTP, the random rapid antigen tests, which costs a pittance. So I think once we've got calm and once we've got the opportunity to think how to get over this pandemic, these are some of the very important things which I think we need to do, we need to have done as of yesterday. And please, let's get it done soon.
Yeah, absolutely. And you've put it so well, and you've highlighted what is the need of the hour, what needs to be done. Avijit Ghoshal, I just wanted you to come in as well on this situation of what needs to be done. And let's emphasize on this for all political parties, but specifically for the state government and for the central government, on Bengal doesn't need this Narada drama right now. The investigation can go on, the CBI can go ahead and file their charge sheet, and the courts will decide what has to happen. But what is needed right now, as need of the hour, is support to people in terms of healthcare.
Yeah, absolutely. I mean, I cannot really dare add to what Dr. Sarkar really said so eloquently. But I have really one genuine point of concern, and perhaps Dr. Sarkar will prove me wrong or right, I don't know. That's the districts this time. I mean, as he said, West Bengal is a one city state. Everything is focused towards Calcutta and focused around Calcutta. The districts are really, really affected this time. And you can make it from the data, the disaggregation of the figures that the state government itself supplies every day. So what's happening to the districts? I don't think much is being done. there are a number of control rooms that have been opened, phone numbers distributed with the media, with the public. But the point is, what about the level of infrastructure? I mean, we know there are district hospitals, but what about the subdivisional hospitals? What about the block primary health centers? Are they really equipped to test a COVID patient? Do they have the minimum basics? Oxygen, for instance, is something very important now. What about the drugs? The names that we keep hearing, do these treatment centers, do they have the drugs? Now, if we know if the districts they are ravaged this time, then nobody really escapes. And talking otherwise, the agriculture sector, which really saved us last year, it was the only sector that grew despite the entire economy being pulled down. If the rural economy is devastated, if the rural people really get infected by a huge number, agriculture will suffer. And can you exactly foresee what will happen to the crops and what will happen next year to the food prices? It all happens in a chain. What we are staring at is a very dangerous situation. And what you are seeing right now is only perhaps, again, Mr. Sarkar, Dr. Sarkar, you prove me right, is perhaps just a little more than the tip of the iceberg. The districts have to be taken care of very, very, significantly and fast. So I think, a sort of cessation of hostilities that you see between India and Pakistan, a great resolve. Something like that needs to be taken between these two political parties right now, because what has happened today, I am afraid it's going to continue, because, CBI is again going to approach the High Court against the order of the lower court today, it has said. And, I see a clear chain now happening. And the political atmosphere, unfortunately, it ebbs, after every election. But it is heating up even right after the election. So I really don't know where all this is leading to with this surging infection.
Yeah, and it's just unfortunate, because now is not the time that you would want the politicians to get involved in this and get distracted or even try and distract people. The need of the hour is very clear for everyone to see. While some of the states may have begun to see a reduction in cases and improvement in recoveries versus the daily cases that are getting registered, that's not the story for West Bengal. And for West Bengal, it's a long way to go before we can go about to that. Now, unfortunately, more and more state governments have begun to believe that just by putting a lockdown and locking people in their own homes for weeks together, they can get by and then claim credit for things to get better. That's not the ideal way to go along. You need to build your healthcare infrastructure. You need to arrange for ventilator and oxygen beds. You need to ensure that there is enough testing and testing kits available. You need to ensure that you work together with the central government and the vaccine makers on bringing in more vaccines and vaccinating people. You need to ensure that your communication lines are open, you're hearing the people, you are implementing the best practices available right now in the country to maximize your bed allocation and treatment facilities. That is the need of the hour. Not any other kind of politicking, not any other kind of dharna. And I don't know what the message is that the other side is trying to send by getting these ministers and MLAs arrested at this time in a case that's not even a recent case. Completely out of time. I'm going to thank our panelists for joining us on this conversation. Quick break. On the other side, we put the spotlight on Cyclone Taukte that has now begun its landfall in Gujarat. Stay with me.